Good morning. My name is Ashrita Yalanki, and these are my colleagues.
Mihika Mishra,
Isma Casaboy,
and Hayden Kinton.
As you know, we are living through a worldwide pandemic. However, an epidemic that is overlooked and has been inflicting everyone long before is sudden cardiac arrest. There are over 500,000 sudden cardiac arrest cases in the US alone per year, and that is why we are discovering new approaches towards prevention, because we believe that prevention is the most effective method to combat this crisis. First, I would like to introduce cardiomyopathy. Cardiomyopathy is a heart disease that results in weaker heart muscles. With weaker heart muscles, it makes it more difficult for the heart to effectively pump blood. 1 in 500 adults have cardiomyopathy, and some may not be aware they have this condition, which is why it's very important to be aware of the symptoms. Some common symptoms of cardiomyopathy include shortness of breath, swelling in the legs, chest pain, dizziness, and arrhythmia. If you or a relative is experiencing any of these symptoms, it is highly recommended to get genetically tested for cardiomyopathy. Genetic testing is highly interconnected and crucial to cardiomyopathy because this heart disease can be inherited, meaning that a mutation in the gene or genes that code for proteins in the heart muscles can be passed on from generations. Overall, it's important to be aware of this hereditary factor associated with cardiomyopathy in order to be able to avoid its health risks. The specific health risk we are targeting is sudden cardiac arrest. Cardiomyopathy can trigger an abnormal electrical rhythm in the heart, and this sudden loss of functioning can cause sudden cardiac arrest. To put this into perspective, 40% of sudden cardiac arrest cases had an underlying cause of cardiomyopathy. In other words, this is 220,000 out of the annual 550,000 cardiac arrest casualties that had cardiomyopathy. And because of the large number of people that are impacted by this heart disease and sudden cardiac arrest, we hope to educate our community on a cost-effective and beneficial preventative approach, and that is genetic testing. Genetic testing is completed to look for mutations in the genes that can cause cardiomyopathy. The doctor will likely ask for a sample of blood, saliva, or tissue to conduct the test. Genetic testing not only benefits you, but your close family members and even your distant relatives. Before diving deeper into genetic testing and cardiomyopathy, my colleague Mihika will discuss QT prolongation syndrome and how important it is in relation to cardiomyopathy.
Thank you, Ashrita. QT prolongation syndrome is very important in relation to cardiomyopathy. But before we discuss that, it's important to understand what it actually is. QT prolongation syndrome is a heart rhythm disorder that typically causes fast and chaotic heartbeats. This syndrome usually goes undiagnosed or even misdiagnosed as a seizure disorder. Patients with this condition may be asymptomatic, but when symptoms do occur, they can be severe and include sudden fainting, seizures, or even sudden death. QT prolongation syndrome is usually inherited through genetics in an autosomal dominant pattern, but it can also be caused by medications such as Zofran, which is an antiemetic typically used in pregnancies, or antibiotics such as Z-Pak and Levaquin. It can also be caused by class 1 beta blockers such as Sotalol and Nebivolol, even though they are used to fix heart problems such as hypertension, chronic stable angina, and heart failure. As you can see on the chart over here, these are 4 EKG readings which all indicate that the QT interval is prolonged. The normal QT interval should be below 0.4 to 0.44 seconds, but this can vary dependent on your age and gender. However, despite your age or gender, anything above 0.5 seconds is considered dangerous. This in turn can tell us that the relative refractory period of the heart is prolonged, which then puts the patient at greater risk for ventricular tachycardia and therefore sudden cardiac arrest. There are multiple different types of QT prolongation syndrome, but the most common are types 1, 2, and 3. In type 1, emotional stress or extreme sports exposure, such as swimming, can trigger arrhythmias. In type 2, extreme emotions such as surprise or startlement can trigger arrhythmias. And finally, in type 3, a very slow heart rate, such as what you get during sleep, can trigger arrhythmias. Whether it's treated or not though, QT prolongation syndrome can be a huge indicator of cardiomyopathy. Abnormal QT dispersion can identify patients who are at greater risk for dilated cardiomyopathy or atypical arrhythmias. QT prolongation syndrome and cardiomyopathy are both genetic mutations that are located on chromosome 11, so it is rare for someone to have both. However, since they occur on the same gene, a combination of both can be deadly. And if you or a relative, or even a distant relative, are experiencing any symptoms of either QT prolongation syndrome or cardiomyopathy, you should get genetically tested to be proactive about your health. Now I will pass it on to my colleague Isma, who will discuss more into cardiomyopathy as she explains the different types as well as the genetic aspects.
Thank you, Monika. So how do our genetics play a role in inheriting cardiovascular diseases? Well, familial dilated cardiomyopathy is inherited in an autosomal dominant pattern, meaning that only one copy of the gene is needed in order for the trait to be passed down. In this type of inheritance, at least 50% of the offspring end up inheriting this trait. There are over 30 genes that play a role in heart contractions through the sarcomeres. Sarcomeres are the most basic functional unit of the striated muscle tissue. Cardiac muscle, found in the heart walls, is a specialized type of striated muscle. A specific mutation in the gene TTN produces short titin. Titin aids in flexibility and structure along with the sarcomeres. Therefore, this mutation impacts the chemical signaling and heart contractions. Familial hypertrophic cardiomyopathy is also inherited in an autosomal dominant pattern. However, mutations in various genes either cause an abundance or lack of proteins, which impacts the sarcomeres, and which ends up disrupting the muscle contractions and weakens the heart. So why is it important for scientists to know this? Well, scientists will be able to detect fatal cardiovascular diseases earlier in order to save countless of lives. Now, my colleague Hayden will talk more about hypertrophic cardiomyopathy and prevention.
Thank you, Isma. So, athletes are viewed as strong and healthy. Nothing can ever be wrong with them, right? Wrong. Hypertrophic cardiomyopathy, commonly referred to as athlete's heart, is a hereditary condition that tends to go overlooked. So what is athlete's heart? A normal heart contracts in parallel, while with athlete's heart it contracts in disarray, and this alignment can cause ventricular tachycardia, and down the road can lead to cardiac arrest. At least one student athlete from the age ranges of high school all the way to professional levels will die every other week while playing or practicing a sport because of athlete's heart. And this is because while the heart is contracting quickly, the enlarged septum will be pushed up against the walls of the heart and obstruct the aortic valve. This will reduce the diastolic filling and can also cause cardiac arrest. So why does athlete's heart get overlooked so often? Because athletes train so hard, their hearts are bigger and stronger than a normal athlete. But since hypertrophic cardiomyopathy is the enlargement of the septum, nothing looks off because a large heart is expected in athletes. But there is a way to tell if you do have athlete's heart. If you restrict your exercise for 6 to 12 months, your heart will begin to shrink, and if the thickness of the septum remains, then you have athlete's heart. Let's talk about some treatments. A septectomy is the surgical removal of all or part of the septum, and a less reliable procedure, alcohol ablation, where you put alcohol into the septum to kill and shrink it, is less reliable because when you put alcohol into the septum, it can cause a heart attack, and that can cause ventricular tachycardia. And also, it's hard to control how much of the septum you kill. These treatments are great, however, the best treatment is prevention. And not just for athlete's heart, but for QT prolongation and cardiomyopathy as a whole, too. That's why we created CardioGeni, Scarf's at-home genetic prevention testing kit that contains DNA collection swabs, saliva sample vials, alcohol wipes, latex gloves, an instruction manual, and a business card that takes with a QR code that takes you to an infographic where you can learn more about genetic testing. Due to its accessibility, reliability, and time efficiency, we hope to target underserved communities to give them an accessible chance to get tested. Now my colleague Isma will tell you more about what a patient should know and expect after getting tested.
Thank you, Hayden. It's so important that patients know what to do and expect after getting genetically tested. If patients do end up having a positive test result, there will be many lifestyle changes they will have to make, like eating healthier, being more active, but also being compliant with their doctors by taking the appropriate medicines and testing. However, if patients get a negative or inconclusive test result, they should still remain cautious and continue to get tested even if they are asymptomatic. However, they should pay attention to any symptoms they may present with or to any family members who do have a cardiovascular disease. I know that I am genetically predisposed to inheriting these cardiovascular diseases due to my gender and ethnicity, and so are my colleagues. But we also know that genetic testing is the future. And that's why by partnering with SCARF, we are taking the appropriate preventative measures in order to ensure our community's safety. And now it's your turn. Thank you.